Dr. Harold, distinguished guests on the dais, newly elected fellows and associates of the college, past presidents, Board of Trustees, Board of Governors, Assembly of International Governors, members of the college, ACC staff, family, friends, and guests. Like all my predecessors before me, I am honored, humbled, and not a little bit intimidated to assume this role at tonight's convocation, a ceremony to celebrate our legacy, bestow accolades on the outstanding achievements of our peers and colleagues, and begin the transition to a new year in our history that will undoubtedly bring its own unique set of challenges and opportunities. Let me begin by first recognizing what I believe to be the extraordinary tenure of Dr. John Harold, a man of unparalleled integrity, dedication, and fortitude, whose actions on behalf of the college will endure for many years. And I'd be remiss I would be remiss also to not recognize his wife, Ellen, a quiet yet steadfast supporter with a keen eye and a gracious wisdom. I look forward to continuing to work with John and the other members of the presidential team, including our new president-elect, Dr. Kim Williams from Chicago, and our vice president, Dr. Rick Chazal from the state of Florida. Let me also acknowledge our newly commissioned fellows and associates, on whom not only our future, but also our present depends. You, as well as tonight's distinguished awardees, are the lifeblood of our profession and our newest ambassadors. There will be much more on your obligations in these roles to follow. A special and heartfelt note of thanks goes to my fantastic family for their unwavering support, tolerance, and understanding, as well as for their committed devotion to each other. I'd like to recognize my wonderful wife, Lori, my guiding light, the bedrock of our family, our three terrific children, who undoubtedly will be our greatest legacy. Our son, Brian, could not be here tonight as he is returning to the United States from a medical mission to Central America. But son Grady joins us from his busy finance career in New York, where he's also training for the world's greatest, that is the Boston Marathon. And for my lovely daughter, Katie, may every father and potential father in this audience be lucky enough to have a daughter like Katie. She will leave tomorrow for Tanzania, where she will present her field research to the villagers in Tanzania she helped over this past summer. To my sister Nellie, who remains older than I am, she is here with her husband Kevin and is representing my 8 siblings and their extended families. And to my cousin Brian Lamb, my role model, and his wife Victoria, who are here to provide support. My siblings and I were fortunate to have grown up in a mutually supportive environment in which the values of family, hard work, and self-reliance were stressed. No one, yet everyone, was special. Perhaps this was the original model for collaborative, non-hierarchical, team-based care. My other role models and mentors have been many. They have more recently included my colleagues at Massachusetts General and Brigham and Women's Hospitals, the residents and fellows who I've been fortunate enough to teach, and several true giants of cardiovascular medicine, including Drs. DeSanctis, Bono, Fuster, Brownwald, and the late Dr. Ken Boffman. I'm also indebted to Dr. Hutter, past president of the ACC over 20 years ago, who gave me my start in the college, to Dr. Peter Libby and my colleagues in the cardiovascular division, Drs. Antman and Krieger, who are in the pathway for leadership at the American Heart Association. However, I am most grateful to my patients and their families for the opportunity to participate in their lives and for extending to me their sacred trust. I believe there is no greater reward in clinical medicine. I will focus my remarks tonight on three interrelated themes of challenge, opportunity, and leadership. You may have heard some of these in Dr. Harold's remarks. But I find it a bit ironic that we are here tonight in this great metropolis, the city of Washington, D.C., that in more recent times has come to symbolize a certain sense of brinksmanship and a remarkable absence of leadership. Contrast this particular environment with the open forums that we have created to encourage debate among the representatives and members of our 47,000-strong constituency. This process has informed a new strategic plan and demonstrated what I believe to be our collective resolve to confront and solve the problems that we and our patients face together. A consensus-driven process of this nature provides an opportunity, in my view, for committed leadership. The stakes in healthcare could not be higher for our patients, their families, our members, the nation, and the global community of cardiovascular medicine. Ceremonies such as this one tonight should inspire us to reach beyond traditional boundaries and set our sights on accomplishing the loftiest of goals. Perhaps we should take a cue from one of my colleagues, Paul Farmer, the co-founder of Partners in Health. In order to improve the health of people living in some of the world's most impoverished areas, including those where HIV and multi-drug resistant tuberculosis are rampant, Paul and his colleagues have simply refused to take no for an answer. They seek to provide first world health care to third world people. Their successes, beginning with delivering life-saving medications to one patient at a time, have profoundly changed the benchmark of what can be accomplished against seemingly insurmountable odds. We are fortunate, I think, to find ourselves in the middle of the current healthcare maelstrom. Any other position would likely render us irrelevant. Independent, hospital-based, and academic medical center practitioners are all struggling with numerous challenges. These include the transition from volume to value, a focus on population health, about which you've heard, uncertain payment mechanisms, public reporting, increasing regulatory demands, workforce changes, implementation of team-based care, fragmented health IT systems, maintenance of certification and other continuous learning requirements, and the ever-elusive achievement of work-life balance. These are challenges, but to name a few. On a broader scale, as John has pointed out, the global epidemics of obesity and diabetes, climate change, and pollution threaten to stall and perhaps even reverse the gains made over the past several decades in reducing death and disability from cardiovascular disease. Similarly, there are alarming trends in income inequality, recalcitrant disparities in healthcare, and uneven access to healthcare services that provide further threats. The plight of our research community and the significant erosion in government, foundational, and industry funding for investigation demand special emphasis and action. We are at risk of losing an entire generation of young investigators, those for whom the excitement of discovery and the opportunity to generate new knowledge may not be realized. Threatened reductions in Medicare reimbursements to academic medical centers, and particularly to disproportionate share hospitals, could lead not only to fewer graduating residents and fellows, but also to unintended cutbacks in health services that are provided to society's most vulnerable patients. But tonight, let us not focus our thoughts solely on such formidable challenges, but rather turn our gaze to the extraordinary opportunities to improve cardiovascular health and wellness that now lie before us. Many have predicted that we are on the verge of what Leroy Hood of the University of Washington has dubbed P4 medicine, namely medicine that is predictive, personalized, preventive, and participatory. Advances in genetics, omics, systems biology, network medicine, nanotechnology, and bioengineering truly have the capacity to catapult us into a near-term future of the more rapid delivery of more effective therapies for a variety of cardiovascular disorders. In addition, the fields of regenerative medicine and stem cell biology have recently witnessed paradigm-shifting breakthroughs to an extent that our long-held hope regarding their practical applicability might yet be realized. Investigator-initiated, ACC registry-based research will yield new discoveries rooted in patient outcomes. Harnessing big data with advanced information technology systems will rapidly accelerate the pace with which insights can be translated into practice. In our daily lives currently, we routinely change the course of disease with transcatheter valves, closure devices, biodegradable stents, hybrid interventions, catheter ablations, life-saving devices, new drugs, and new biologics. Telehealth and telemedicine will soon become commonplace and extend our reach to greater numbers of patients in their own environments and provide more value at lower cost. Our collaborations with other members of the healthcare team, and in particular with our brethren, the cardiac surgeons, is now assumed and not enforced. We share numerous educational activities and advocacy priorities with all major US-based cardiovascular specialty societies and also with our many global partners in the fight against cardiovascular disease. This annual scientific session is but one example of what can be accomplished with the active participation of our domestic and international partners, many of which are represented here on the dais. Lastly, and perhaps most importantly, we have learned much from our cardiovascular team members, from our patients and from our families regarding what I think is the true meaning of patient-centered care and shared decision-making. I wish for you, our newly designated fellows and associates of the college, to envision where along this spectrum of opportunity you will fit, and to think more broadly, if only for tonight, of a shared calling that requires your active participation. As John has mentioned, the college has spent the past year formulating a mission-based strategic plan to serve as a guiding set of thematic initiatives to align our priorities and overcome the challenges our patients and we as a professional organization face. Our goals are founded on the triple aim of improving the personal experience of care, improving the populations of health, and reducing the per capita cost of care. Simultaneously, we seek to strengthen the values our members derive from their involvement in this college through point-of-care, personalized educational activities that you can access in a learner-specific format. Our continued emphasis on the development of clinical practice guidelines in close collaboration with the American Heart Association and the subsequent derivation of performance measures and appropriate use criteria designed to reduce variability and promote best practices are absolutely critical. Our patient registries form the backbone of our efforts to track the elements of the care we provide, to inform the design of local and systems-based quality improvement initiatives, and allow for the execution of outcomes-based and comparative effectiveness research. We have begun to explore the potential of high-throughput data and information management in partnership with other stakeholders. Consider a future in which genetic, proteomic, and metabolomic information will be integrated seamlessly with the clinical data elements already captured as part of our daily workflow. Our competitive advantage in this space lies in the expertise we bring to the clinical assessment of the associations we have yet to discover. We will continue to advocate effectively for patients for the high quality, efficient, and effective personalized care they deserve and for the highest interests of our profession. No doubt our current strategic plan will require timely and nimble revision, but our legacy will be defined by our ability to stay focused on our mission. To the newly inducted fellows and associates of the college, you have always been the major focus of this convocation ceremony. You are now invited formally to participate in the college's activities and to hold its leadership accountable. You are also called to execute your duties with the highest professionalism. You have chosen this organization in order to improve it. It is easy to interpret such words with guarded skepticism and a begrudging tolerance for yet another gratuitous speech at time of graduation. However, we are very serious in our commitment to your future. To our fellowship award winners, we celebrate your exceptional accomplishments, and we look forward to following the trajectory your careers will take. We are confident in your creative energies, that they will blaze new trails for discovery and innovation on behalf of our patients. To our distinguished awardees, we thank you for your inspiration and your leadership. May each of us aspire in our ways to follow the examples you have set in your contributions to the broader communities of science, healthcare, and education. And to our assembled partners here on the dais, let us renew our commitment to work openly and perhaps more efficiently to solve the cardiovascular health problems that confront us both domestically and globally. Let us keep the focus more on the patient and the many issues that detract from our ability to provide high-value care in a changing environment, and focus less on any need to claim individual credit for advancing the needle a short distance. The coming year will differ in several respects from the immediate past. I'm much shorter than John Harrell. However, rather than declare a topical theme for the year, I, along with our Board of Trustees to my left, have chosen to emphasize the more continuous nature of the work in which we are engaged and the priorities we have adopted in our strategic planning process. We will officially welcome Valentin Fuster as the new editor-in-chief of the Journal of the American College of Cardiology. But I would also like to take this opportunity to acknowledge publicly the extraordinary tenure of Dr. Anthony DeMaria as the soon-to-be immediate past editor-in-chief of the Journal of the American College of Cardiology. Dr. DeMaria. We enter the second year of working with our CEO, Mr. Shal Jacobowitz, to my immediate left, and we anticipate continued collaboration with the college's outstanding professional staff. Building on the work of my predecessors, I plan to foster an environment of openness and focused activism, beginning with our boards and extending all throughout the ranks of the college. We have an incredible wealth of talent among us. We need to delegate more effectively. We need to prepare the way for our younger colleagues. Consensus, a focus on patients, and respect for all members of the healthcare team will certainly sustain such efforts. Now, I have entertained several pithy quotes by which to close this session, and I'm sure most of you are waiting for a sports cliche, and I have a few Larry Bird cliches up my sleeve, but they may not be okay for mixed company. So instead of quoting the wizard from French Lick, Indiana, I've decided that I will quote no one other than my late mother, who would have turned 100 years of age in January of this year. And she was fond of saying in a half-joking way, "Watch your brain." Yikes. So I interpreted her warning several ways when I was a youngster growing up, obviously depending on the context in which it was given, and there were many contexts, and you can multiply that times the 9 children that she had. Concretely, I think she was telling us to protect our assets, to take nothing for granted, and to appreciate the subtleties in life. Yet, I think in her words there was also a message of humility along the lines of knowing your limits, avoiding analysis for its own sake, and refraining from any pretense of superiority. Tonight, let us recall the sense of altruism that drew all of us to this profession in the first place, and endeavor to lead more from the heart. I think our future and that of our patients depends on it. Thank you very much.